Now we'll discuss antitussives, also known as cough suppressors. Okay, now we need to learn something why cough is a protective mechanism. In our body, what why our body creates or sends a cough reflex is if any mucus stuck in the lungs or in the airway that will be come out through the mouth when you are coughing. Okay, that's called productive cough. That is also called as wet cough. So what it will do to our body is it will help us to clear the mucus from our airway. So it's not that necessary to clear this to clear or to stop this productive cough. Okay, or wet cough. There is no need to use any medications to suppress productive cough or wet cough, because if you are suppressing the wet cough, the mucus in our body won't come out. Okay, it's a body reflex. Our brain will create by its own. Okay, now when it comes to dry cough, it will irritating our lungs. Okay, it will create irritation in our lungs, and it won't clear any mucus. It is non-productive cough. So you need to suppress this kind of cough. First, we have two types of cough. One is wet cough. For this wet cough, there is no need to suppress or there is no need to use any medications, because this will help our body to clear mucus. Second one is dry cough. We need to use medications to control this dry cough, because it's not useful to our body, and it will create irritation to our airway. Okay. Here mechanism like central acting and peripheral acting. Now we'll discuss about the composition. Opiate derivatives like methyl, morphine, action. Like what's the action mechanism of action will be depresses cough center in medulla oblongata. What will do? It will depresses. It will suppress the cough center in medulla oblongata, reduce cough reflex sensitivity. This is a medication used for dry cough, not for wet cough. Okay. And dose will be 10 to 20 mc oral every 4 to 6 hours. Route will be oral. Indications: dry and irritating cough. Contraindications: productive cough, respiratory depression, head injury, child under 12 years. Drug interactions: potentiated sedation with alcohol, antihistamines, CNS depressants. Side effects: constipation, drowsiness, nausea. Adverse effects: respiratory depression, dependence with prolonged use. Toxicity: overdose, coma, the shallow respiration. Like sometimes if you are using overly, it may lead to coma, shallow respiration, or pinpoint pupils. Role of nurse: assess cough types before giving. Before directly going to a medical store and asking for a cough, it's better to analyze what the type of cough. When you're coughing, if a mucus is coming out, that's a wet cough. There is no need to use medication. It will be reduced by its own, because the medulla oblongata sends a receptor, medulla oblongata having a cough reflex center. Okay, it will send signals to the lungs, and through the airway the cough will come out. Okay, so there is no need to use any medications to control the cough. If you are having dry cough, then you need to use the medication. Avoid use in productive cough. Advise no driving or alcohol use. Monitor respiration depression. Dextromethorphan. This is another drug for dry cough. Composition: systemic derivatives of morphine. Action: acts on cough center in medulla, but no analgesics or addictive properties. Doses: 10 to 20 mg every 4 hours. Route will be oral. Indication: dry cough. Contraindication: asthma, productive cough. MAO inhibitor therapy. Side effects: dizziness, nausea, mild drowsiness. Nursing role: inform patient it may cause mild sleepiness. Avoid combining with hypertensive, avoid combining with MAO inhibitors. Now we'll discuss antihistamines. The concept is this is another classification, okay? This is another drug, antihistamines. Antihistamines, the major, how can you remember why we need to use antihistamines? First, when our body having any kind of allergy, that causes receptors to release something called histamine, okay? Now, these antihistamines block histamine receptors, reduce allergy, okay? Our body release, when our body having an allergy, it will release histamine. So if you are taking antihistamines, that medication will directly go into our body and block antihistamine receptors. Okay, that will reduce the allergic response. Types: first generation, second generation. In first generation we have diphenhydramine. Composition will be ethanolamine derivatives. Action: blocks both center and the peripheral H1 receptors, reduce histamine efforts and causes sedation. Dosage will be 25 to 50 mg every 6 to 8 hours. Route is oral, IM and IV. Indications: allergic rhinitis, motion sickness, insomnia. Contraindications: glaucoma, urinary retention, asthma. Side effects: sedation, dry mouth, constipation, blurred vision. Role of a nurse: warn after drowsiness, warn about the drowsiness. Avoid drowning, provide oral hygiene for dry mouth, encourage fluid intake and fiber for constipation. For second generation, we have cetirizine. Cetirizine is the most famous drug in India, where everybody uses this. Composition will be piperazine derivatives, selective H1 receptors antagonist. Action: blocks histamine at H1 receptors, so reduces allergy symptoms. Okay, doses will be 10 mg per day. Oral tablets and syrups. Indications: allergic rhinitis, urticaria, seasonal allergies. Contraindications: hypertensive, severe renal disease, drug interaction, increases sedation with alcohol, CNS, depressants. Side effects: mild drowsiness and dry mouth. Adverse effects: rare liver dysfunction, rare condition, tachycardia. Toxicity: rare and systemic management. Symptomatic management. That's a rare condition. Nurses' role: warn patients about mild sedation, avoid alcohol, encourage regular timing. Last classification, we have bronchoconstrictors, used only experimentally or to test airway sensitivity. Example: histamine challenge. Concept: opposite to bronchodilators, cause airway narrowing. We already know bronchodilators, right? And this is an opposite mechanism where it will, when you are taking this kind of medication, the passage through the blood will be reduced. Okay. Yeah, what's the concept? Drugs that causes airway narrowing. Example: histamine and methacholine are not therapeutic, used only for diagnostic testing. This medication is not for therapeutic. This is used only for testing purpose in labs and testing environment. Okay. Action: muscarine receptors antagonist, reaches to bronchial smooth muscle contraction. Indication: diagnostic tests for airway hyperreactivity. Nurses will conduct only under medical supervision with emergency resuscitation equipment ready, monitor respiratory status continuously. So we end up with this bronchoconstrictors. The conclusion will be: understanding respiratory drugs enhance nursing care for enabling safe administration, proper monitoring, and patient education. Effective management of respiratory conditions improve patient quality of life and reduce complications, highlighting the nurse's critical role in pharmacotherapy. So that's it, guys. I hope this video make you to understand about this respiratory drugs. Okay, after this, please take note and write important points related to this chapter. If you're having any doubt, please DM me through my WhatsApp or Instagram. So thank you so much for joining in the video. I hope you'll enjoy your next moment very well. Thank you so much.